So I'm Sarah Sweeney Denham. I'm the head of Greentown, and I'm really excited to introduce my colleagues here. At Greentown, I'll just give an umbrella for what this event fits into. So at Greentown, our mission is not only to teach the children, but also to partner with families. And so our school and many Montessori schools have a pretty robust parent education program because we know that if strategies and philosophies are aligned between school and home, it's an even better outcome for the children. So please take a look at the series that we have to offer you and the classroom workshops and potlucks that your teachers will be providing, because it's part of our overall approach and mission. So this is the first one of the year, and I'm really happy to introduce Lisa Dissinger, who is a consulting school psychologist and also has a private parent coaching practice, and really is a specialist in child development, and has worked with Greentown for 26 years and over 30 years in her practice. And is just a great resource for families and for staff on child development. So I'd love to start every year with families having an opportunity to know about Lisa as a resource. And then I'm happy to introduce Emily Bittner, who is our new Montessori director and dean of faculty. And that is a position here that really helps to support the Montessori heart of the school in every way, through working closely with the faculty, but also a resource for families. And also, Emily is trained as a Montessori teacher and administrator, so a wonderful resource to add to our growing community. And so this is an exciting time of year. You guys are in the thick of it. It is the start of the year. And we've been so excited to welcome your children in every day. Thank you for coming. And we're excited to see them again tomorrow. But we know that's a big step for your child, for your family. And so every year we try to have a conversation about some facet of this kind of transition in the family system. And so that's what Emily and Lisa are going to talk about today.
Terrific, thank you. Thank you. So welcome everybody. Good for you that you got here in the afternoon. You get some brownie points for that. And what I've done today is on your chair is the article that I wrote. You might have even seen it on our website. It is a summary of what I'm going to talk about today, and it's really, to me, the basic, this article speaks to the base of what I believe all parents need to do to kind of help their kids transition through their developmental years. So I've given you, I'll articulate it, and then you can have it to bring home and remind you. And the wonderful thing is Emily and I are just meeting together today, first time meeting each other. And I asked Emily to add some tips and strategies as well, speaking from a teacher perspective. So we're gonna work together. I'm gonna start, Emily will add. And if there are questions, feel free. I'll certainly at the end ask for any. And I'm hoping I don't do any PowerPoints anymore. I'm going back to the old-fashioned, like you have to listen and not look anywhere other than the speaker, because I feel like it helps me encourage you to be present in the moment, to really take a moment to think about yourself as a parent, what you're doing. I hope what I say is reinforcing, not to make you feel like you're not doing what you're supposed to, but more just reinforcing where you're coming to. I am a parent of a 28-year-old son who started in Montessori many moons ago. I started working in Montessori, I think, way before Pete's birth, and then certainly worked through his development. So sometimes you'll hear me even talk about Peter, but I am someone who loves Montessori, both as a psychologist. I love the theory of creating an independent learner. I believe that our jobs as parents is to eventually let go of our kids so they can go out in the world and do what they need to do for themselves. But it's a long process, a long journey of letting go. So today what I'd like to do is just start. So all you have to do is listen. It's all written there for you to go home with, to someone else who you might feel you want to share the information with. But I want to start with what should we expect of our toddlers, preschoolers, kindergartners. Because I think sometimes as parents we feel surprised by our kids' emotions, and they're big. Some of them are really big, and I think that was the first thing I had to learn was kids have very deep emotions starting at very young ages. So it is not uncommon for kids to have some anxiety around separating, and that can come in the form of going to bed at night. That's a time for separation, right? They're having to say goodbye to you so they can go to bed, and sometimes I hear a lot of families struggle at bedtime. And in part, that's because a lot of anxiety comes from that separation process, both for the parent and for the child. And the same with dropping them off at school for the first time, or maybe it's the second year of school. It happens anytime you leave them, sometimes with a babysitter. We were talking about, before we started talking today, about grandparents. Once a grandparent is staying with you, or maybe the grandparent is visiting, that creates a whole new dynamic and can create some anxiety. Once the grandparent is a familiar face, feeling some anxiety for the child at least about having to say goodbye to the grandparent. So separation anxiety, very normal. It starts, so part of me always feels that it's important to remind parents how we handle our anxiety will matter in the future, how your child handles theirs, and in the present. So it starts with you. And so how you handle, first and foremost, is important. So I'm going to say that you are the role models. I can speak for myself. I get triggered as a parent by certain things. Like I like to be places on time. So going to the airport was always a big deal for me. Getting there, and I would have to say out loud to both my son and my husband, okay, this is not my easy time. I'm gonna be, until I get there, I'm not a happy camper, and I'm a little bit pushy and maybe not so nice all the time. And knowing my trigger, it was kind of a joke by the time my son got old enough to recognize, like, Mom, he would start telling me, Mom, you're gonna be okay. Like he was doing what I did for him and for my husband when they would get anxious. Learning how to just be good about acknowledgement and what are some things that are helpful and not hurtful. So I'm going to strongly encourage that at least learning how, even if you're not feeling calm, learning how in the face of your child's pain or upset or crying, how to be zen, how to be just okay with them not being happy campers. Some of us, Lucas and I were talking, for some of us, when our kid cries, it doesn't trigger us. We're okay. We understand they're crying, they're upset, but things will be okay. For others, when the child cries, it sets off something internally that is really hard. And so some of us want to just shut it down. You don't need to cry, there's nothing to cry about, but the fact is they're going to a new school, or there's a babysitter that's, or mom's going away for a while. There are times where adversity is real. I happen to think, I'm of the philosophy, if we start young with helping them just manage that, like being okay with their upset, I think that that's half the battle. So I talk about parents learning how to be emotional containers. Instead of getting all jazzed, upset, oh my gosh, my kid's upset, just learning how to sit with the emotion and not letting it start you going down the rabbit hole with them. So an emotional container to me means being okay with the fact that sometimes your kids are not going to be happy with something you're saying to them, a place they're going, they're feeling anxious, learning that that's actually a good thing for them. That they need to go through some adversity before they leave you at 18. They need to know they can get upset, they can cope, you are going to be okay, they are going to be okay, and you're going to get to the plane on time, and if not, you'll miss it and you'll catch the next plane, right? It's the learning how to manage emotions. I want you to think about being aware of what happens to your voice and your nonverbal language. Because I know when I get anxious, because my voice goes up, and I get really, I start a little bit more rapid fire talking, and learning what my nonverbals are telling me so that I can say, you know what, I need a couple minutes, because I'm really angry, and I need to not say something I'm gonna regret. Now, when you have really young kids, toddlers, sometimes I'll say to parents, it's not a bad thing to take a time out, to model. Like if you're getting upset and it's not helping the situation, maybe you have a partner who you can say, tag team time, you need to hang in because I need some time. I really believe in that partnership. If you're lucky to have that significant other who you can share, sometimes when you feel triggered, then offer up the other and say, you need to take it from here. So learning your nonverbal language that might be signaling you're upset. One of the things as a parent coach that I spend a lot of time with parents doing is what do we say sometimes matters. And we don't always have to talk a lot. 10 seconds or less. I can see that you're sad because this is something new, but you're gonna be okay. And doing the short and sweet. I was, before we started today, talking about when my son in his kindergarten year started crying again when he was saying goodbye to me. And this had been a classroom he'd been in for 2 other years, so it was like, didn't make sense to me. So I was like working overtime to try to figure out what's wrong. And it was the teacher who said, Lisa, just leave and he will be okay. And he was. So learn what is yours. If you're lucky, you have a teacher you trust, and that's really what this next kind of couple of weeks is all about. Is for some of us, we're anxious because we don't trust it's new. If it's a new environment, it's hard to have that immediate trust. And part of that is just time, and part of that is recognizing you picked a good place. Part of it is just knowing that when you have to say goodbye to your child, short and sweet is always probably a good thing. One of the things that I like to recommend just in terms of the goodbye is to always make sure you say something very positive, especially if your child, is anybody here having a child who's crying when you're dropping them off, or is everybody's child doing beautifully coming in?
Great day one.
Yeah.
Great day one.
It's just day one.
Yeah, tomorrow could be a different day.
She's not too happy.
Yeah.
She's hanging on to my leg and
A little bit of a struggle. And
Going in has been okay. She hasn't cried going in. I'm not sure what happens when she's in the classroom. If she's
right.
I did see picking her up. I saw that she was crying probably before.
Yes.
So
So
Yes, and
again,
her like sleep is also, those last 2 days have changed dramatically. I think she is like overwhelmed. Even if
yes,
she's not, like, maybe it's not crying that she's showing, but like, I think it's manifesting in other ways in her
Yes.
behavior at home and at night.
and what's really good about what you're saying is sometimes it's not the obvious crime when you say goodbye to them. It comes out in different other ways. And again, I think just learning that being able to see in 2 weeks, it will look different. Being able certainly to be in the moment with them, but also for me, I had a very picky, didn't eat very well in the beginning of life, very picky eater. And I remember somebody saying to me, Lisa, when he's 18, he'll be eating a lot of different things. Kind of being able to look a little forward with a positive, like, this too will pass. And the sleeping will get better and the routine will get better and the consistency is what they need. So, and Simon, you were saying, yeah, easy day.
So far,
Yeah,
really good.
Yeah.
And then we'll see tomorrow, but so far she's been really excited and yeah.
and just remember that roller coaster is real, meaning some days will be not so good, some days will be good, and then expect that it may not always be even. And like for me, it was his 3rd year that he started crying. And I was like, what is this all about? I expected it, in the first experience. But one of the things I recognized even personally is that separation anxiety is a lifelong journey. Saying goodbye to your parents at different moments and learning how to master that feeling of, will I see them again? I'm not sure I will see them again. When will I see, all of those things that even as an older person, it's just all part of the journey. So the thing I'd like you to think about for you is just be the role model, try to be the emotional container, know that this too will pass, and be good if your partner struggles with when, your child gets upset, that you kind of say, let's tag team. I'll take it from here, or I'll bring her to school for this week. It's easier for me, I'll handle it. Learning how to do that. For your child, I'm gonna kind of skip back and forth. I want you to be the role model, and I want you with your kids starting very early on. I use the word developing your child's emotional agility. You hear a lot about emotional intelligence. It's a part of learning how that your feelings, whatever you're feeling, you can handle. One of the things that I have done over the past 9 years at a lower school with just girls was develop a curriculum to develop this emotional agility. And what I did with my son is the first thing you need to do with developing this emotional agility is get first comfortable with the emotions. It's okay to be sad, believe it or not. And I had to teach the girl, it's okay to be angry. It's not okay to be mean. And that was learning that the emotions are okay. Even jealousy, talk about a really tough one to say to kids. I get that seeing what someone else has or what someone else is doing, you would feel jealous about. That's normal, but it's not a bad emotion, it's just one of the many. Get comfortable first with your own emotions. That's where the role model piece comes in. Get good at encouraging your kids to talk about how they're feeling. Now, I'm not looking for everybody to talk till they're blue in the face about feelings. Like, I think some parents take this to the nth degree. I say, try to teach your kids about emotions, and then they spend hours talking to their kids about the emotions so that the kid who is acting up should have had a consequence many moons ago, but the parent was wanting so badly to have an emotionally agile child that the child was basically ruling the roost while sharing their feelings. So I'm okay with acknowledge their feelings, I like to say build an emotional vocabulary. And I've got a few books here that help to do that. I think all of us need a good library for lots of things. But this is a book, How Are You Peeling? Foods with Moods. And it's just a great book about lots of feelings and this very creative photographer who, like, the fruits are talking kind of thing. Love that one. This one's just, again, a classic when Sophie gets angry, really, really angry. And at the end, she figures out, go climb in a tree and things get better. How do we acknowledge the feeling, do something with the feeling, and then ultimately what you're going to hear me talk about is there are different pieces. First, you have to build the emotional vocabulary. You have to let the child feel it, don't negate it. When they're sad, it's okay to let them be sad. I think crying has a real important, it lets you know they're upset, but I'm also, when I see that my son at 28 is upset, he knows that I will listen and I will not go down the rabbit hole with him. I will try to hear him, and if he needs to do some problem solving, I'll do that. If he just wants me to hear, this has been a really bad day, I feel really awful, I'm really okay. I don't negate the feeling, and I don't try to shove it anywhere under any rug. It's really okay. I believe the issue really is all the difficult feelings like jealousy, anger, upset, frustration, that what we need to teach kids is it's okay to have the feeling, it's just how do you express it? So I'm okay with my son being angry at me, but he needs to do it in a way that I can hear it. If he's screaming at me, I'm not hanging out for that. Much like as a parent, if I'm screaming at him, he has always had permission to leave because I don't think that's being respectful. So our family rule was it's okay to be angry. It's not okay to be disrespectful. Mean is one of the words I use in a school setting because that makes more sense. But by the time Pete got to be 6, he understood what I meant by being respectful. So the feelings are okay, it's how we show them. And then finally, learning that you can do something with feelings. You can cope with them. Emotional agility is not just saying this is how I'm feeling, it's knowing I've got ways to manage this. Now, you've got 2-year-olds perhaps, and you're thinking coping? Probably you're not quite there yet. But we give them art materials. We give them Montessori materials to explore. There's a lot about exploration that is therapeutic. Just sometimes sensorial materials can calm the system. So one of the things that's really neat about dropping a child off, even if they are upset, is typically within the first 5 to 10 minutes, they have found something that is going to calm their system because the classrooms are filled with those kinds of materials. So I want you to, when you are experiencing your child's upset, to let it, try not to negate it, try to be the container, maybe distract them if you feel that that's needed, but I also want you to watch it go. I say to parents all the time, watch your child recover and notice that each day, like you'll drop them off and they might cry one day and it might be for 10 minutes. And then the next day, it's 8 minutes. And then the next day, it's literally about a minute or 2. The recovery, the watching it go, is what you want to focus on. Not that they don't cry at all, it's just as their system learns to recover. The other thing I want you to think about, even with young children, and again, This is my fancy word for read a book about it. There are books now for coping skills for little kids. This one is for my youngest. B is for breath, and it's the ABCs, and for every letter there's a coping skill. It's by a psychologist, I believe, Dr. Melissa Boyd, and I love this. When I taught emotional agility in the school, I taught kids yoga as a way to transition, and I taught them relaxation as a way of, again, just taking a moment to yourself. And I do believe we can teach our little ones lots of different coping skills. So thinking about ways to do that, books are helpful. I love this book. Anybody who's heard me talk, I can handle it. It's a mantra. And it's one, Lori Wright wrote this book, and I give it to every single kindergarten child I've taught myself, but it just talks about the feeling and all the things you can do with that feeling. And it goes through all of them. These were all books for young kids. So this is not something you have to wait till they're 18 to introduce. And in fact, I'm going to suggest that many parents aren't focusing enough on developing good coping skills for their kids and for themselves. So start with yourself, figure out what do you do that helps you cope. Some of us, I exercise every day. That's just what I call the way in which any stress or anxiety I have, or walking, all of those things help me cope. Drawing, for some kids, is magical. I was doing a coaching session with some kids the other day, and I do something called a community drawing, which means I draw and then you draw, and I draw, then you draw, and we create something we don't even know what it will be. And it's a way to kind of both have a parallel playing with a child, so I can hear from them what's going on. So watch it go, develop some coping skills, and then another thing I want you to think about with your young kids starting at this age, using mantras to get them to begin to develop resilience, the ability to bounce back, and learning how to be more positive, seeing the glass half full versus empty. So I use mantras all the time, whether I'm parent coaching or working with kids or as a teacher. So you've heard me say it's okay to be angry, it's not okay to be mean. With bouncing back, we talked a lot about this at the school where I was. It was a big theme because girls sometimes aren't always their most resilient selves when it comes to social interaction. Somebody's mean to them, then they go down the rabbit hole and it takes the whole day. So learning how to kind of come back quickly. And being positive. A family I just coached, they were going away. Hi, welcome.
Hi, everybody. Thank you.
They were going away abroad and it was gonna rain a lot, and the mom was already getting anxious about what the kids were gonna be like, and so we did the 4 Ps so I spent a little time coaching this family about the 4 Ps. I read the book, Be Positive, because I wanted them on this fabulous trip they were going on to get the most out of it, even if we know that sometimes trips are for the parents and not for the kids, right? If we're doing it for the kids, they're happy sometimes just to stay home and have a grand time. But we did the 4 Ps, be positive. I explained to them what that was, and this was a 5 and a 7-year-old. Be pleasant, be playful, and be patient. When you go traveling, you have to stand in a lot of lines, things like that. So it actually turned out they had a great trip. And I'd like to think some of it was how we promoted being positive. Because these kids aren't always like that. So, reading books, and another book I wanted to mention. Has anybody ever read The Invisible String to their child? So if your child is experiencing some separation anxiety or maybe going through like not they're not showing it, but you're thinking they're feeling overwhelmed or there's a lot of changes in the midst, there's a book called The Invisible String. And it is magical because it explains that even when the parent isn't there, they're still there. There is this invisible string connecting the child and the parent. And that could be for a grandparent too. If the grandparent is leaving after having spent a long time, that an invisible string is basically the whole notion. That once we love someone, it doesn't mean that they're not there in our lives anymore. It just means they may not be physically present, but they're always there. So find books that send the message or can help you. So I'm gonna stop for a moment and segue over to Emily. This is not so easy because it's, but really we were talking, Emily and I, about some tips for parents and strategies for kids, and that's what I've been talking about, but in a more kind of global way. But in terms of just the first couple of weeks, what are some things that might help parents and kids kind of just make it easier, just in general?
Well, I think one of the main things is just acknowledging that this is going on, and I love what you said about it being a lifelong transition. Just this morning, so the roles reverse sometimes. Sometimes you're the one that has a hard time, and you want to hang on, and being aware that maybe that's going on more so than it's your child wanting to hang on. But just this morning, I pulled up to drop my 8-year-old off at the bus stop, and I happened to make a comment like, "Oh, it's going to take this amount of time to get to work at this time of day." He's like, "All right, Mom, you get going, and I'll just get out here." And this was my first time. He's at a new school this year, so it was my first time taking him to the bus. And I'm like, "Well, no, I'm going to stand with you until the bus comes." And which, so I lost 5 minutes and he's thinking ahead. "Get to work, Mom. I'm cool." So it really it does go on, and it manifests in different ways, and it takes different forms. But when I think back, or when I think about, I'm not sure the age of each of your children, I'm presuming maybe mostly toddlers, maybe 3-year-olds. And you have, being aware of the feelings you're having when you're dropping your child off, like Lisa was saying, sometimes it might be just cut and dry and that's fine, and sometimes you might actually, I can even, looking back on it, I can feel that, I'm pointing to my chest because that's where I feel it, like the anxiety's radiating out. You just want to help them, and you want one more hug, and you want them to know how much you love them, and how excited you are for them, and all of these things. But being able to put yourself in that container, like you're saying, it takes work. It's not, it's not going to happen just after sitting here in this talk today. It requires being aware of yourself and being aware of your child, and that's not easy to do all the time. So I think one of the main things that I would want to say in terms of tips for parents is to give yourself that grace and that awareness that this is a transition for you also. That, it's an emotional transition, and it's one that has to do with logistics and getting the family at the door on time, and did we remember this and did we remember that, and these things take time, and we want it to all work right away, and we want to be excited that they're going to school, and we want them to be excited that they're going to school, but they might not be, and that's okay. And you might not be, and that's okay also. But in terms of just some specific things to keep in mind, and you might be hearing these from your classroom teachers as well, is just emphasizing that children really thrive on routines. And so the more you can keep the next few weeks routine in your home, the way that you normally do bedtime and the way that you normally wake up, the better for them. So that means some people use like picture charts. I'm not sure if you guys are familiar with that, but just having your child know what to anticipate is next. So, we're gonna eat dinner, and then we're gonna brush teeth, and we're gonna read a book. Not that you would tell them all that at once, but just keeping in mind that the more routine they have, the more settled they are. Because children are constantly, they're taking in stimulation all day long. And so the more things that they don't have to think about and don't have to defend themselves against to process, the better. So they just know, I go to bed, I get up, I have cereal, I get ready, I go to school. And that happens over and over. The more that they can take some of that anxiety away from them of what's going to happen next and just focus on getting out the door. And straightforward language. You touched on this a lot. Being mindful to not infuse your own emotion into the situation that's happening, but naming the feelings that are happening.
And I'm gonna add, I hope you'll remember this for when you're down the pike. Don't interview for pain. Some parents get not just triggered by their child's upset, but then they start sometimes making it worse.
Right.
By, how was your day? Who did you play with? Were you by yourself today? And they'll, and this would be particularly as kids get older, parents, get anxious because the child's come home and said, no one will play with me. Or whatever. So be very mindful of how we talk. Certainly I believe we need to, sometimes 10 seconds or less is all they need. And just not to interview for the pain. Doesn't mean you don't acknowledge, I can see you're sad. I can see you're sad. We're going to a new school. It's kind of a hard, it's new, right? But your teacher's so excited, ready for you to come in. So let's go in. 10 seconds or less. So, yeah.
Right, and that just reminded me too, when you're talking about interviewing for pain, after all the after-school questions, that it might be that your child was fine all day, and then as soon as we walk them out the door, because I saw this happen twice today, as soon as they see you, they start crying, and it's like, what's wrong? Or you can tell, like you said, you could tell your child had been crying, and it's so hard not to know right away. And sometimes it's just that they see you and they can finally fall apart because they know that you're there to hug them, and they just went through a lot. They just held it together all morning.
Anticipatory anxiety is what that is.
Or they're just settled and they're just, and then it's time for them to go. And
Right.
so
They
the
don't wanna go.
teenagers are interrupting them, and so they might be completely settled, but any transition point like that, they'll start up again.
It is normal. There's quite the cacophony of crying. That just yesterday and today, and it settles, and it rises and it settles. But it is how they express themselves. It's one of the main ways they know at this age. It doesn't mean something's wrong. That's really, really hard to believe. And that's okay, but it's hard to believe.
Any other thoughts, tips, strategies that you can recommend? Or did we together?
I think together, yeah. I love that you have some of the books here. That one in particular, I Can Handle It, is my favorite.
So remember mantras?
Right.
Is that find the one that works for you, not the one that works for me, but I used a lot with my son, you're gonna be okay. And I would say out loud, I'm gonna be okay. Those were, for whatever reason, helped me, but a lot of the girls, I Can Handle It really was a great mantra for them because it's very empowering. One other concrete thing I want you to think about having in your back pocket, if you're finding your child's anxious, upset, and you know that you need to distract them, and you're not quite, so one thing I do recommend is just ask them to show you their hand. And then show me your pointer, breathe in, breathe out. And I want you to breathe with them because half the time it's that we're holding our breath too. Breathe in, breathe out. And kids at this age need the concrete, we say just breathe, what is that? Use a concrete, breathe in, breathe out. By the time you get to the pinky, they are already, their systems are calming down. Another way to do it that's concrete with young kids is draw a square. Let's make a square. If they're still upset, just let them watch you make a square. Breathe in, breathe out, breathe in, breathe out. Now you're thinking, well, my toddler doesn't know what a square is, but you're basically teaching them or you can make a circle. Let's make a circle. Breathe in and breathe out. Shh. And then you can go the other way. I mean, be creative. Doesn't have to be a shape, it could be a flower in the air. Let's make the petals. But find something, a very concrete way of being with them in the moment, knowing that you're gonna hug them in a second to say goodbye, but you want to do something to help their system be a little bit calmer, because you're sensing, even if they're not crying, you're sensing they're anxious and you want to give them something to kind of hold on to. So find what works for you is really important. Find what works for your child. Sometimes just reading a book. Now you can't do that at drop-off. I'm not gonna suggest you stay, I'm just gonna do what Lisa said and read a book for a minute. That's not the time to be reading the books, but there were definitely things for me as a parent that I always could rely on that would help my son. And one for sure was just read a book. Sometimes reading a book about whatever it was that he was struggling with without making it about a discussion is sometimes the ticket. And there is a book about everything and anything written. So, or you can make your own book. So I've done that too. It's called A Social Story. So questions, thoughts, things that come to mind as Emily and I were talking. That.
What if your child just doesn't want to calm down?
Yeah, they're invested in
We'll be
being
like,
upset.
Oh, we try the deep breath thing all the time, and he likes smelling cinnamon, or he has a very strong sense of smell in general, and then exhaling, blowing out a candle.
Yeah.
And so we try to do that with him, and he'll just be like, I don't want to take deep breaths. I don't want to calm down. And we're like, okay, breathe in through
So what I would say to that is he's kind of sometimes it's like when siblings are fighting, and I'll say to parents, do you realize they're enjoying some of this? They sound horrible, and somebody's definitely sounds like they're getting brutalized, but there's an element of enjoyment. And sometimes the drama, the upset, there's something good in it, in the expression. I might just say, you know what? I'll just be here. You go ahead. Or try again later, or if you need to be upset, I'm gonna be here with you. And I might, instead of asking the child to breathe, I might do my own because I'm upset watching this thing, but I'm gonna try to be like the emotional container, so I'm just gonna hang in there with you, try to talk myself down off the ledge and say, if it's all right while you're going through this, I'm just gonna do the breathing. Is that all right? Listen to the, so you could role model what you want them to do, because they're not buying it, and I'm okay with not buying it. I mean, sometimes when I do things in a classroom and some kids are like, are you kidding? I'm not doing yoga right now because I'm just not in the mood. And and sometimes it's, we're in the class, we're gonna do it together and you'll do the best you can. But in the case of the breathing's not working, sometimes just sense of humor. Seems like you're kind of enjoying being upset, so I'm gonna be okay with you being upset then. So I'm gonna give you 5 minutes. 5 minutes to be upset. I might go this route. This is what a cognitive behavioral therapist might say. I'm gonna give you 5 minutes to be upset. So, we're starting. We've got 5 minutes and I'm gonna be here with you. And that might rile them to no end, just having you do that. Give them, but giving them a circumscribed amount of time. At 5 minutes, if they're still upset, I would say, it's okay to be still upset, but we're moving on. You've kind of done what you need to do and move it on. So time it. Role model what you're hoping eventually someday they'll do, which is breathe in, breathe out, and let it go, for goodness sake. My mantra would be, in 5 minutes, I'm hoping you can let it go. But I'm gonna give you 5 minutes to be in it, if that makes sense. So I'm gonna be creative, because not one size fits all. You could get 10 of us in the room coming up with 10 ideas about ways to handle emotions. There is not one size. So I've kind of given you some of what feels comfortable to me, but if something's not working for a child, find something else. Sometimes literally taking a child's hand, do you need a squeeze? Sometimes they're still having a great time being upset, so they don't want to squeeze, they don't want to hug, they don't want anything. But sometimes just literally saying, do you need a lap? Do you want to be upset in my lap? Because I got this big lap here, it's waiting for you, come and give it to me. Basically, the message is, I can handle it, whatever you're coming with, and you're gonna be okay. Because my job as a parent is to make sure you are safe. That doesn't mean you're gonna be free of anger and sadness and jealousy. Your main job is that they are safe. If they are upset and they're hurting themselves, then my job is to make sure you are safe when you are upset. So I'm gonna do a basket hold. Because the one thing I'm not gonna let my child do is be unsafe with their emotions. I'm gonna be okay with what they're feeling, but if you're unsafe, you're hurting yourself, you're hurting me, you're hurting someone else, never okay. So get really clear about what is your job to make sure your child is safe and loved. Everything else is icing on the cake. I think emotional agility is like love and safety. I think if our kids can be emotionally agile, then they will be okay in the future, whatever they do and say in their relationships. So to me, it's like a fundamental, but does that help? Just think about it.
Sometimes too, there's a lot of power struggle that's going on with parents and children. And so there might be they're yelling and you're saying stop, and so there's this tug of war. And if you just take away that wall, then then they don't have to fight as hard anymore. So for example, this is one of my favorite stories. When my oldest was young, we were at the beach with my parents, and my oldest was screaming their head off, and everyone, one after the other of the extended family, was defeated by them. And my dad, and we're trying to get to the beach, my dad picks up my child and starts walking down the street, and they're screaming, and my dad says, louder, louder, let it out. And that was what they needed at that time. They let it out. And then it was we're not trying to keep you from feeling your feelings. You know what I mean? Let it out, see how it feels.
That is a cute story.
Yeah.
A child was crying in the grocery, and it was clear the mom wasn't letting said child have what they wanted, and the child was just going for gold. I mean, they had this incredible audience, and everybody's looking at the mom, and I said, are you singing for everybody right now? Are you singing? And again, kind of that paradoxical intervention.
Yeah.
But sometimes they don't want that either. They're just, we're not sure what they want. But I do agree that sometimes we get engaged in a battle that we don't need to engage in.
Yeah.
Just learning, that's what I mean by it. Whatever works for you in terms of emotional container, just be with them. They don't want the breathing? Okay, we're not breathing right now. We're just going, hold your breath. Can you hold your breath? How long can we do that? I don't know. Can you do that? I mean, again, I might try a sense of humor. I might try like the opposite. Let's hold our breath. If you don't want to breathe, well, let's hold it. So, any other questions, thoughts? Yeah.
Just to continue off of that idea,
Sure.
Which we do sometimes, but we also have a second child now. And once our toddler starts freaking out, and sometimes we'll let him, ride with it. But other times it's like you just can't because the baby is
The domino
sleeping
effect,
or
or
something, or like she's suddenly triggered because he's freaking out, and then she starts freaking out because he is, and it's like, so how do you deal with that when you have this other person who is also needs to develop not just emotional agility but
Sensitivity
and emotionally and everything else that there's balance in the household.
So there's several things going on. First of all, it is hard when the 2-year-old needs to scream and shout for whatever number of reasons, and the infant needs the quiet so that they can stay regulated, because infants get dysregulated for lots of reasons, but especially when things are upsetting and they hear another child cry, they're likely going to just naturally respond to that, especially if it's a brother or sister. We've seen that just in research. You become very sensitive at a very young age. So part of me feels like if there are 2 parents, divide and conquer as best you can. And we're not always with a partner, but if you do have a partner at that moment, I would divide and conquer. I would take, if the infant is the one sleeping, then I would ask said partner, even if it's raining, get the umbrellas, go outside, take a walk around the block, but let's divide and conquer. That's how I sometimes say to parents. I also believe that if kids are really upset, sometimes the infant's just gonna get disturbed, disrupted, but the infant will be, in your mind's eye, again, remember in the long-term future, they'll still be okay. But in the moment, it's gonna be really upsetting. It's gonna feel like pandemonium. And I feel strongly that if sometimes we don't know what to say and it feels like it's crazy, don't say anything. Get very quiet. Even if, take care of the infant if you can, and and try not to give too much attention for the negative behavior. It's like that power thing that can go on. If we give too much attention to the upset and the carrying on, it becomes like a way to get your attention. Try to catch them in the act of when they're being expressive in a way that's okay. Try to give them minimal attention for when they're throwing their tantrum. Even if it's upsetting the infant, just remember this infant, I know it's bothering this infant right now, but infants are resilient too. It's just amazing what they can experience. So remember, it's all about you staying calm. Try not to say anything. Take a time out, not physically by making everybody anxious by leaving, but just get really quiet. And they will, if you don't feed the negative behavior, it will go eventually, they will recover. Sometimes it's what we say to them that keeps it going. So I don't have any magic wand other than this will pass, and as they get older with language skills and social skills, you will be able to put them in, if one is upset, you'll be able to say, you need some time to yourself, but we're not at that age yet, where you can divide and conquer the kids. So divide and conquer through the partnership, and use, even if you're in a city, you can always walk outside and come back in when the going's better. And louder, louder, loud, have at it. We are outside, go for it. Just learn not to make it worse. And, because I think our anger sometimes fuels their anger too. They're upset, you're angry. He's bothered the baby, for goodness. Now the baby's up. and maybe needed to sleep, all of those things that go on. Just know, the silver lining is they'll be grown up really soon and you will not be dealing with this, I promise, it'll be something else. So on that note, everybody, thank you for coming and welcome to Greentown. It's really just a wonderful place to be. Nice for me to be here. Welcome to Emily. And have a good first couple weeks, now that you know just what to do.